Welcome back to the Island Docs. We have our special guest with us today. This is Dr. Candice Culpepper, who's about to tell us a bit about diabetes.
Let's welcome her to our show.
Thank you. Thank you. It's a pleasure to be here.
So Candice, tell us a little bit about what a diabetic should expect in their signs and symptoms.
So the classic signs of a diabetic, they will present with symptoms such as excessive urination, excessive thirst, weight loss. Sometimes they will complain of having blurry vision. Okay, and if these symptoms are occurring and then they go to their doctor and they check their finger stick and it is high, then most likely the patient does actually have diabetes.
Okay, so what are the usual end organ damages that happens with people with diabetes?
So diabetics with a prolonged history of uncontrolled blood glucose will run into problems such as vision loss, kidney failure, neuropathy, which is a big word for nerve damage, as well as non-traumatic amputations from open wounds that don't heal.
Wow, very, very serious. So if you're a new diabetic, you're newly diagnosed, what are some of your recommendations?
So as a newly diagnosed diabetic, I would highly recommend, first and foremost, modifying your diet and also getting lots of exercise. I also recommend checking your blood glucose regularly, at least twice a day in the beginning. I also recommend following up with your doctor once every 3 months. And you also need to see an ophthalmologist and a podiatrist at least once a year to check on your eyes and your foot.
So what exactly is your HbA1c?
The hemoglobin A1c is a test that doctors use it could aid in the diagnosis of diabetes, and we also use the A1c to see if the treatment plan is working for the patient.
So what's a good number for those diabetics out there? They have an HbA1c. What number do you want them at?
So the target HbA1c for diabetic would be 7% or lower.
So your HbA1c is supposed to be about 7%, but not everybody's at 7%. What is it when somebody's at 9% or 10%? What does that actually mean about their blood sugars?
So the hemoglobin A1c is a test that's supposed to correlate with the average blood sugar over the past 3 months or so, okay? If someone has a hemoglobin A1c of 7%, it means that their blood glucose is running somewhere between 120 and 140. If your hemoglobin A1c percent is rising to 8 or 9, it means that on average, the blood sugar is running possibly in the 200s or higher than that.
Like how you're not controlling your blood sugar as well as you're supposed to. That means
Right.
You're running at a higher number constantly.
Exactly.
So every time you go up by one number, that means you're going up and your blood sugar is running higher and higher.
Which is what we don't want in a diabetic, because uncontrolled blood glucose is what is going to lead to end organ damage and all the problems that diabetes is associated with.
I know sometimes some patients have diabetes and some people have it when they're very, very young in their teens, and then sometimes some people have it much later on in life. Is there any reason for that big disparity?
Yes, so there is type 1 diabetes, which tends to occur in children or young adults. And type 1 diabetes occurs when the pancreas, which is an organ in the abdomen, doesn't produce any insulin, okay? And this is because the body's own immune system has destroyed the cells in the pancreas that produce insulin, okay? So that they present at a younger age. In type 2 diabetics, they present a little bit older in age, and there tends to be a strong family history associated with type 2 diabetes. And type 2 diabetes occurs when the body is producing insulin, but it's not enough to cover the glucose intake of the body, or the body may have a resistance to the insulin that's already there.
So what about you're diabetic and you have other comorbidities? Because a lot of diabetics might also have high blood pressure, they might also have cholesterol. what do you recommend for that diabetic that's probably a little bit separate from those who are just diabetic only?
So for the diabetics that have other comorbidities such as high blood pressure, high cholesterol, they may already have heart disease. It's extremely important to control the glucose and these other comorbidities to reduce their risk of developing cardiovascular disease, strokes, and other end organ damage conditions.
Oh, thank you so much, Dr. Culpepper, for coming on our show, giving us all this insight on diabetes. I hope everyone has gotten some good information on diabetes and diabetic control. And when we come back, Ostra Fleming is going to share her story about how she changed her life when she got diagnosed with diabetes. So stay tuned.